If you're over 60 and you wake up with a dry mouth every morning, don't click away. What I'm about to share could help you identify a health problem before it becomes something far more serious. Most seniors assume a dry mouth is just another part of getting older. But according to leading medical organizations, persistent dry mouth is not considered a normal part of aging and is often linked to underlying health conditions or medication side effects. In fact, one hidden cause we're going to discuss today is so commonly missed that many older adults live with it for years before discovering what's really happening. And the fifth cause may surprise you the most. Before we begin, let me know in the comments. Do you wake up with a dry mouth every morning? Simply type yes or no. I read as many comments as I can, and your experience may help someone else. Also, if you're passionate about staying healthy, independent, and active after 60, subscribe to Healthy Wisdom for Seniors and turn on notifications. Every week, we share practical, evidence-based health advice designed specifically for older adults. Now let's talk about what your body may be trying to tell you. Dry mouth, known medically as xerostomia, occurs when your mouth doesn't produce enough saliva. That may sound harmless, but saliva is one of your body's most important natural defenses. It helps protect your teeth, supports digestion, makes swallowing easier, reduces harmful bacteria, and keeps your mouth healthy. When saliva production drops, the risks go far beyond simple discomfort. Chronic dry mouth can increase the likelihood of tooth decay, gum disease, oral infections, difficulty swallowing, and even nutritional problems. The first and most common cause is medication. Hundreds of prescription and over-the-counter drugs are known to reduce saliva production. Medicines used for allergies, high blood pressure, anxiety, depression, bladder problems, pain, and even common cold symptoms can all contribute to dry mouth. Medical experts consistently identify medication side effects as the leading cause of chronic dry mouth in older adults. Many seniors take several medications every day, which can increase the risk even further. What's concerning is that people often spend years treating the symptom without realizing the real cause may be sitting in their medicine cabinet. If you regularly wake up with a dry mouth, make a list of every prescription, over-the-counter medication, vitamin, and supplement you take and discuss them with your doctor or pharmacist. But medication isn't the only possibility. The second cause may be affecting millions of seniors who don't even know they have it. Obstructive sleep apnea. If you snore loudly, wake up tired, experience morning headaches, or find yourself sleepy throughout the day, this section is especially important. Sleep apnea causes repeated interruptions in breathing during sleep. As a result, many people unconsciously begin breathing through their mouths. Over the course of an entire night, this constant airflow dries out the mouth and throat. Medical experts recognize mouth breathing and snoring as significant contributors to dry mouth. But the real danger isn't the dry mouth itself. Untreated sleep apnea has been associated with cardiovascular disease, stroke risk, high blood pressure, memory problems, and reduced quality of life. If your dry mouth is accompanied by loud snoring or excessive fatigue, it may be time to speak with your healthcare provider about a sleep evaluation. And what we're about to discuss next is one of the fastest growing health threats among older adults. The third possible cause is diabetes. Many people are shocked to learn that a dry mouth can sometimes be one of the body's earliest warning signs of elevated blood sugar. When glucose levels remain high, the kidneys work harder to remove excess sugar from the bloodstream. This process pulls more fluid from the body, increasing dehydration and reducing saliva production. Diabetes is widely recognized as a common medical cause of chronic dry mouth. You may also notice increased thirst, frequent urination, blurred vision, fatigue, or slower healing of cuts and wounds. Here's what makes this especially important. Millions of adults are living with prediabetes or diabetes without realizing it. Sometimes a seemingly minor symptom like dry mouth appears long before a diagnosis is made. If you haven't had your blood sugar checked recently, consider speaking with your healthcare provider. Now let's move to the fourth cause, and this one is often overlooked because it seems too simple. Chronic dehydration. As we age, our natural thirst signals become less reliable. Many seniors don't feel thirsty even when their bodies need water. Health experts note that dehydration is a major contributor to dry mouth in older adults. Some people are mildly dehydrated every single day without realizing it. Over time, this can contribute to fatigue, dizziness, constipation, urinary issues, confusion, kidney stress, and persistent dry mouth. If you're someone who says, "I just don't feel thirsty," that doesn't necessarily mean your body has enough fluids. Consistent hydration throughout the day is one of the simplest ways to support overall health. And now we come to the fifth cause, the one many seniors never suspect. Sjögren syndrome. This autoimmune disease causes the body's immune system to mistakenly attack moisture-producing glands, particularly those responsible for making saliva and tears. As a result, affected individuals often experience chronic dry mouth and dry eyes. Medical organizations identify Sjögren's disease as a significant cause of xerostomia. Women are diagnosed more frequently than men, and symptoms often develop gradually over time. Some people also experience fatigue, joint discomfort, swallowing difficulties, or recurrent dental problems. Because symptoms can appear slowly, many people assume they're simply getting older and never seek evaluation. Here's the most important takeaway from today's discussion. A dry mouth every morning may seem like a small problem, but sometimes small symptoms are the body's earliest warnings. Whether the cause is medication, sleep apnea, diabetes, dehydration, or an autoimmune condition, identifying the root cause can make a tremendous difference in your long-term health. If you regularly wake up with a dry mouth, don't ignore it and don't assume it's normal aging. Instead, use it as a reason to start a conversation with your healthcare provider. Before you go, I'd love to hear from you. How often do you wake up with a dry mouth? Have you discovered what was causing it? Share your experience in the comments below because your story could help another viewer. And if you found this video helpful, please give it a thumbs up, subscribe to Healthy Wisdom for Seniors, and share it with a friend or family member over 60. Remember, the earlier we recognize the warning signs our bodies give us, the better our chances of staying healthy, active, and independent for years to come. Thank you for watching, and I'll see you in the next video.